Now, experts around the world in rural health have advised governments to take a systematic approach to tackling the coronavirus crisis rather than focus solely on urban areas. One of the biggest concerns as South Africa went into lockdown was seeing thousands departing for their rural homes ahead of the beginning of the lockdown. Joining us now to find out how public health facilities in these rural communities are working to fulfill their mandate against the crisis is Dr. Lungile Phephetha, Executive Dean of the Faculty of Health at the Nelson Mandela Metropolitan University in Port Elizabeth. Dr. Lungile, good evening and thank you for your time.
Good evening, sir, and welcome to the viewers.
Applying your rural lens to the COVID-19 response, particularly as I mentioned, when the lockdown was announced, the exodus of people leaving and going to their rural homes, but also when level 4 was announced to say some economic activity can now resume, we saw those very same people using the 7-day grace period to rush back into urban areas. That in itself bringing all sorts of dynamics. What dynamics come to play for you?
The issue about the rural areas is actually the readiness of our facilities in terms of screening, and we talk about expedited screening and mass screening, and also targeted testing readiness. I'm not so sure that as a country we are there yet in terms of being ready for that. The other dynamic is ensuring that then the issue of lockdown is observed in rural areas. I'm not so sure if that is happening at all in the rural areas at this point in time. But also there is something that is very good that has been done by government in terms of relief, social relief grants that have been rolled out by government in terms of the Solidarity Fund. But then the issue around that is that the payouts are on the same day. And that what that does is that there is actually flooding of the rural towns by our society to go and cash out on these grants. And then, as we have seen, there's no social distancing there or physical distancing at all. And neither is there any use to a significant state of the face masks and all other issues that we need to observe when we are talking about preventing the spread of the coronavirus. So then the virus is going to spread in the rural areas. We will never be able to know how much of that is spreading in the rural area.
Talk to me about that practicality of screening and testing, right? We have seen that some of the residents in those communities lack the information that is required for them to understand what is going on. There is a clip that did the round, for example, on social media. A lady in her home refusing to be tested, in fact, even refusing to let the health workers come in, saying, we've heard that one of you in your clinic has been infected by this virus. Now you're coming into my home. You want to test me. How do I even trust and know that you are not bringing this virus right now to my house? So that practicality of screening and testing in rural homes.
Yeah, my biggest issue then around rural areas as well is the issue of education and educating society around coronavirus and what testing means and the benefits of testing and isolation or quarantine, and which then would curb the spread of the virus. That is not happening at all in the rural areas, and there's a stigma that is attached to being COVID-19 positive. And we've seen people hiding the fact that they've actually been screened and they've tested and they are positive, and they fear that they might lose their jobs, and also they are not sure how society will treat them, and there is an issue of them being ostracized by society, which then falls into the issue of society not understanding what COVID-19 is all about as a disease. And therefore people are not coming up forward to state that they have been screened or tested for coronavirus, and this is how they are dealing with that condition. So there's an issue of stigma attached to it, but most of it, I think, stems from lack of education in terms of educating our society. And if that education is lacking even in the urban space, then there is a lot of ground that we need to cover in terms of educating the rural areas.
Should government be thinking to diversify its strategy when it comes to, as you mentioned, the health, the education, and the social services when dealing with urban and rural areas?
Yes, definitely. They need to actually put those in place. And I am not so sure if there is, in fact, a plan to roll out that in the rural areas at this point in time. I do know there's a lot of work that is being done in urban and peri-urban space. But even in the peri-urban space, our informal settlements, our townships, I'm not so sure of that, whether then we are educating them to any substantial extent at this point in time.